And now to Obamacare. If you thought it was bad that members of Congress voted for or against the 2,800-page health care bill without reading it, wait until you hear this one. The regulations tacked onto the health care bill are stacking up literally, and no one who voted for or has written even one page of that regulations. 828 pages of new regulations written by HHS workers released in just one day. That now brings the total to a staggering 20,000 plus pages. And there are more regulations coming. Does anyone really know what is in all that paperwork? The Hill's Elise Viebeck joins us. Elise, if you went to the Senate Minority Leader's office, and I know you did, and took your picture by the stack of those regulations, you're 5'5", is that right?
5'5", and I was wearing 3-inch heels, so take that into account. So
behind you in that picture, those are 20,000 regulations that have been added onto the 2,800-page bill.
That's right. 20,000 pages stacked up in the corner right off the rotunda of the Capitol. Is getting a lot of attention today.
All right. And you see any members of Congress? They didn't write those, right? No member of our Senate, House, or Senate wrote that?
No, they didn't.
And you didn't see anybody reading those, right?
No, they didn't.
All right. Well, who wrote those 20,000 pages of regulations that have been added onto the 2,800-page bill?
That would be our federal regulators. That's their job. And to be honest, Greta, I mean, we know that this would be the case with any bill. This is the way the sausage is made. The stacks of paper are going to be huge, and nobody denies that this is a really big healthcare overhaul.
I guess the problem that I always have, though, is that we elect these officials, and this is so monumental, healthcare. And I was always troubled by the fact that people voted for something that they'd never read. I mean, fundamentally, that seemed like, how would you know if it was good enough if you hadn't even read it? But on top of that, now we have 20,000 pages of regulations tacked onto this bill by people we didn't even vote to who didn't read it.
That's right. Well, I mean, it's a very complicated bill. It really does overhaul many, many parts of the healthcare system, and so they needed to draft tons and tons of regulations in order to make it work. I guess the good news is the people who are going to have to deal with this are mainly insurance actuaries, they're state insurance commissioners, they're the insurance companies, they're people who are, professionally made to do this.
The problem is that it should be, this stuff should preferably be simple so people can understand it, and people should read it who are responsible for it.
Right.
Fundamentally, you'd think.
You would think, and if people want to go read it, they can. I certainly have to read it in my job, and it's hard to pick through. I think if people really applied themselves, they probably could read it, but it's definitely complicated.
All right, let me ask you about the regulation, the mandate. Any news on the mandate?
We do know what the penalties are going to look like if you don't obey the mandate. Starting next year, it's going to be about $100 if you don't carry insurance. It's going to ramp up to about $700 by 2016. And so that's definitely a big increase over a couple of years for people who aren't carrying health insurance. This is the big part of the new healthcare law. People are required to carry insurance.
All right, if you're going to game the system, then you're probably better off not buying the mandate in the first year, because $100 if you get caught, that's the penalty.
I mean, that's what people are saying. It's not strong enough to induce people to enter the healthcare system in the first year, and so it might be a little bit of a rocky transition. A lot of people might choose to pay that $100 instead of buy insurance.
And of course, we have, I think, existing in this bill is that if you're a pre-existing problem, you can always get insurance, today or tomorrow or the next day, so that you can go out and buy it, so you don't have to worry about getting caught for not paying the mandate.
That's right. And so health insurers have been making the case that the Obama administration needs to make these penalties even stronger to induce people to enter the system and make sure that everything works okay.
Well, the advantage of the system was if everybody was in it and everyone was pitching in and spending money. The problem is, though, is a lot of people have gotten waivers, lots of organizations have gotten waivers, so they're not going to be in it, right?
We don't know yet. We really don't know exactly how it's going to work out. I mean, it's true that there have been a lot of waivers, but I think we're going to have to wait and see until next year when most of the law's provisions take effect and we see whether or not the system works. I mean, really, there's so much that's going to happen. There's going to be so much in flux, and we're just going to have to wait and see.
Does anybody know what's going to happen?
No, I don't think they do. I really don't think they do.
That's what's so mystifying about this whole thing, is that we have this enormous bill within 20,000 pages of regulations. Nobody knows how it's going to have whether it's going to have an impact. Nobody even knows the economic impact.
Well, a lot of people, we have to remember, are welcoming this bill. I mean, that image of the huge stack of regulations is going to be a welcome sight to some people. To Democrats who supported it, absolutely, and people across the country.
But they don't even know how it's going to. They don't even know if it's going to be successful. How can they possibly? Nobody's even read it.
They're saying it's good that the federal government is going to step in and try at least to solve problems that the private sector couldn't.
This is the same federal government's got how many thousands of empty, vacant buildings around the country that we don't even know what we're doing with them. It's like, I guess if you fundamentally think that the government is efficient, knows what it's doing, I mean, that would probably be good. But if you've been around town long enough, you might be scared when you see all the waste that goes on.
Well, it's definitely a different sense in perspective.
I hope it works out, but boy, I think it's terrifying when nobody's even bothered to read it. Anyway, Elise, probably the only person who will ever read the 20,000 pages. Nice to see you. Thank you.
Greta.